To the House.
And I'd like to say very clearly to the House today that, and say this once and for all, that although we've seen plans for universal mandatory vaccination in some countries in Europe, I will never support them in this country. Yeah. I firmly believe that getting vaccinated is something that should be a positive decision, and I can assure the House that the government has no intention of extending the condition of deployment to any other workforces or introducing mandatory vaccination more widely.
I'm grateful to him for giving way, and he's making a strong...
Now that there is community transmission of Omicron in the UK, and Omicron has spread so widely across the world, the travel red list is now less effective in slowing the incursion of Omicron from abroad. So I can announce today that whilst we'll maintain our temporary testing measures for international travel, we will be removing all 11 countries from the travel red list effective from 4 a.m. tomorrow morning.
I thank the Secretary of State for being so generous with these interventions.
We can see that the growth in Omicron cases here in the UK is now mirroring the rapid increase that we are seeing in South Africa, and the current observed doubling time is around every 2 days. Although yesterday we reported there were 4,713 confirmed cases of Omicron in the UK HSA estimate that for the number of daily infections was 42 times higher at 200,000.
I thank the Secretary of State for giving way specifically on the regulations. Given the regulation about refusal of entry, given the small number of venues and...
So, Madam Deputy Speaker, for the reasons I've set out, I do believe the responsible decision to take is because of all this, is to move to Plan B in England, drawing on the measures that we've held in contingency to give more time to get those boosters into arms. These are not steps that we would take lightly. I firmly believe in individual liberty and that the curbs should be placed on our freedoms only in the most gravest of circumstances. And not only that, I am of course mindful of the cost that restrictions can bring to the nation's health, to our education, to the economy. The rest, about 1/5, are there
Many of my constituents have contacted me concerned that these measures today are the first step in further restrictions against social gatherings and businesses. Will he assure them today that this is not the case, and that if we can rescind these measures earlier than the 26th of January, we will?
I suggest what I'm about to say next, I think, will give my honourable friend that assurance that these plans would make high-risk environments safer than they would otherwise be. But this regulation, this particular regulation, in fact, all these regulations, the measures on face coverings, they will be reviewed by the 5th of January, and they will all sunset on the 26th of January. That's the point I think I would emphasise in response to my honourable friend's question. They would sunset on the 26th of January. And even if the government wanted to do something different and change this some way, of course it would have to come back to this House and seek the House's approval. I will give way.
He's quite right that these are not vaccine passports. His backbenchers and the Liberal Democrats are completely wrong about that. But can I warn you...
The test and release, though. He will know, many of our constituents, many of mine have contacted me to say they cannot, for love nor money, get hold of lateral flow tests right now. Yeah. Could he update the House on whether this problem has been resolved?
The warehouses of the UK HSA, they have plenty of stock. The distribution channel has been limited, although they have added to that significantly in recent days, including building on the channels they had with Royal Mail, with Amazon and other suppliers, and also opening up more access points other than direct ordering online, so that people can pick up tests, for example, from far more pharmacies than they currently can do. But it is something that is being worked on, and I think whatever the current situation is, it will improve very, very quickly. I hope that reassures my friend. Closing.
I thank the Secretary of State, and he's making some vital points about testing and self-isolation, but I did raise a point with him yesterday about PCR.